Yeah, I hope the voice is audible now. I hope the voice is audible now. Can you please let me know, is the voice audible? Is the voice audible, doctor? Now audible. Very good, very good, very good. All right. Yes, sir. Now audible. Very good, very good. So once more, let me start from the beginning. Let me start from the beginning. So, good morning, everyone. The whole idea behind this spring sessions is to quickly equip you. 1 minute. I'll just change the voice, the audio. Hello? Yeah, good. Yeah. Can you please punch? Is the voice loud and clear now? Ravinder and Shrikant, everybody? I just changed the camera. Can you let me know, is the voice audible now? Is voice audible? Loud and clear. Very good. All right. So the whole idea behind these spring sessions is to quickly give you an outlook as to what are the most common topics asked in the exam. Tomorrow's exam, especially if you look at the contraception, definitely 3 to 4 MCQs are going to come in the tomorrow's NEETPG exam, which you have to be very well prepared about. So, yes. Now, doctor, if you go to the learnograph.com, you have all these snapshots. You can download them, and as the PDFs, each has got around 500 mind maps and about 400 to 500 MCQs, which will give you a very good practice. Now let us see the IUDs. Tomorrow exam, you will remember me. At least 3 to 4 questions are going to come in the topic of contraception. Another 20 to 25 minutes, I'm going to revise you the entire story of what to expect, 190 points in the contraception, from which definitely 3 MCQs will come. What is the IUD preferred for multipara, doctor? Multiparous, monogamous, low STD risk patients, IUDs are preferred. IUDs act by preventing fertilization by spermicidal action. They cause biochemical histological changes in endometrium. IUDs impair the sperm ascent. IUDs affect the sperm motility. Copper IUDs prevent implantation by the enzymatic interference is what you need to remember. So what is Gynefix? Gynefix is a frameless 4th generation IUD with 6 copper cylinders on a nylon thread is what you need to remember. Nice to see Ravinder, Shrikant, and many more. Can you please punch? Is the voice now loud and clear for all of you, doctor? Can you please punch? Is the voice loud and clear? Good. Gynefix. You need to go back to the Google images and then look how Gynefix looks like. Gynifix is a frameless fourth generation IUD with 6 copper cylinders on a nylon thread is what you have to basically remember, right? On a nylon thread. So, first generation, second generation, third. What is the difference? Lipid loop is inert, non-medicated, first generation. If there is a copper or silver, you call second generation like copper T, 380, AG, Nova T, ML, CU, 250, 375, etc. Third generation are hormone releasing IUDs like progesterone, Mirena is what you need to remember. So how do levonorgestrel containing IUDs act? They suppress the endometrium, makes the cervical mucus hostile and very thick. They cause anovulation. If there is no ovulation, there is no corpus luteum. If there is no corpus luteum, there is no progesterone to support the endometrium. There is a luteal phase deficiency. That is how levonorgestrel basically function. Mirena has 52 milligrams levonorgestrel. How much does it release? 20 micrograms per day, effective for up to 5 years. Skyla contains 13.5 milligrams of levonorgestrel. Fibroplant contains 52 milligrams of levonorgestrel and release 14 micrograms per day and tested in both perimenopausal and postmenopausal use also. Levonorgestrel IUD has no effect on ovary, please remember. Progesterone, it releases 65 micrograms of progesterone. It will make the thick mucus plug at cervical os. It prevents sperm to penetrate. It reduces the menorrhagia, dysmenorrhea. So there is another non-contraceptive use of progesterone IUDs. It will reduce menorrhagia and dysmenorrhea. So one of the favorite questions in the NEETPG tomorrow, the numericals that you need to remember is effective life. Copper TA 380A 10 years, Mirena 5 years, MLCU 375 5 years, Copper T 200 is 4 years, Multiload 250 is 3 years, Progesterone is 1 year, Mirena is 5 years. Please don't forget. What are the other uses of IUD? Good to see 7 online classmates. Even in Asherman syndrome, we use IUD. After the excision of the uterine septum also we use the IUD. If there is any suspected pregnancy, it is a contraindication to IUD. What are the other uses? Remember, IUD is not used for premenstrual symptoms, which are mainly a disorder of ovarian function. IUD has a very little effect on ovary. So what is the technique of IUD? No touch technique and withdrawal method. When will you insert IUD? Within 7 days after the onset of menstruation. If it is pregnancy, immediately after the first and second trimester termination of pregnancy, immediately you can put IUD. And IUD, after delivery of the baby, we insert it after puerperium, more than 6 weeks postpartum. And after inserting, contraception is still practiced for about 7 days. Now, this is the mother of all questions. Absolute and relative contraindications. You should be very clear about this. Definitely one MCQ tomorrow NEETPG में आज मैं बहुत sprint sessions conduct करने वाला हूँ. Every sprint में only guaranteed topics only I will pick up and give you so that it will be of help for you. Endometritis, PID, genital TB, absolute contraindication. Undiagnosed vaginal bleeding, DUB and pregnancy, absolute contraindication. Severe distortion of the uterus, carcinoma endometrium, carcinoma cervix. Wilson's disease is for copper T. It is specifically absolutely contraindicated. In breast carcinoma, Mirena is a contraindication for breast CA. So what are the non-contraceptive therapeutic indications for Mirena? Please don't forget. Menorrhagia, endometrial hyperplasia, fibroids, premenstrual syndrome, and endometriosis. Mirena is used. What is the most common cause of IUD removal? Pain. Most common side effect? Bleeding. Average blood loss is 80 ml. Maximum risk of infection after IUD use within 20 days of insertion. Most common infection with IUD use, actinomyces. Whenever IUD is missing, what is the investigation of choice? You will do ultrasound to discover it. If there is any previous ectopic, it is not a contraindication for IUD use. Decreased risk of carcinoma ovary, endometrium, and colon. They are the benefits of the oral contraceptive pills is what you need to basically remember. What are the other OCP benefits? डांस करते हुए, नाचते हुए बाथरूम में आप रिविजन करना है इसको. Decreased breast disease, fibroadenoma, decreased pelvic inflammatory disease, but increased monilial vaginitis. They're all the OCP benefits. Dysmenorrhea decreases, ectopic pregnancy decreases, functional ovarian cyst decreases, anemia decreases with OCP by reducing the blood loss. Is there any general medicine condition OCPs will benefit? Rheumatoid arthritis, OCP benefits. Rheumatoid arthritis के लिए OCP benefits. Please don't forget, doctor. Acne, hirsutism, third generation progesterone's benefit is what you need to remember. OCPs decrease the fibroid. OCPs decrease the osteopenia, decrease osteoporosis. Now, what are the detriments of the OCP? Please don't forget that. CA cervix increases, breast malignancy increases, hepatic and pituitary adenomas increase, thromboembolism increase. OCPs will lead to the gallbladder stasis, leading to gallstones, cholesterol gallstones. They lead to cloasma. Estrogen in OCPs can lead to breast pain. OCP increase the risk of UTI, chlamydia, monilial, candidal vaginitis. OCP can increase the risk of depression. Whenever OCP is causing the depression, we treat with vitamin B6. So please don't forget, doctor. Is the voice loud and clear for all of you? Srikanth, Ravinder, please give a feedback. So, in this last moment before exam, आज जो भी हम पढ़ते हैं कल नीट पीजी में आना चाहिए. That kind of topics only we should read. Please don't forget. Now, there is increased risk of depression. So please don't forget. Increased risk of depression treated by vitamin B6. There is no increase in hepatocellular carcinoma, only adenoma there is an increased risk. There is an increased risk of gallbladder cancer, but gallstones, but not gallbladder cancer is what you need to remember. About breast cancer, some studies say OCPs increase the risk. Other studies say there is no risk, be very sure. Now, combined oral pills. Can the online students can punch? Is the voice loud and clear? Once more, just to reassure me. Yeah. So, yeah. Can you please punch? Is the voice loud and clear, doctor? Is the voice loud and clear? Is the voice loud and clear? Yes. OCPs decrease glucose tolerance. They cause intensification of pre-existing diabetes. They increase the insulin secretion. They create insulin resistance. Please remember. Hypertension, hepatocellular adenoma, not carcinoma, strongly associated with OCPs. If you are giving anti-epileptics, be careful. Contraceptive failure can occur. That's the reason. If there is a patient with seizures, do you want to give OCP? बोल के पूछे तो examiner, we don't prefer. OCPs are not advised to breastfeeding women, even in non-lactating women. They are started more than 6 weeks after the delivery. Now, what are the absolute relative contraindications? Ekdam. What is absolute? What is relative? Very clear right now. Examiner idhar ka idhar karega. Uncontrolled hypertension more than 160 by 110. Thromboembolism, cerebrovascular disease, coronary heart disease, CA breast, migraine, focal neurological deficits, undiagnosed vaginal bleeding, like dysfunctional uterine bleeding. Known pregnancy, suspected pregnancy, liver disease, infectious hepatitis, age more than 35 with smoking, they're all considered to be absolute contraindication. Absolute है, relative है, इधर का इधर, नको mix कर. Right? Thank you, Rajesh, for the feedback that the voice is loud and clear. Hypertension, diabetes, obesity, hyperlipidemia, elective surgery, migraine headache, uterine fibroid, sickle cell anemia, any nursing mother in the first 6 months, SLE, seizure disorders, inhibition of ovulation, breakthrough bleeding. So they're all the relative contraindications. Inhibition of ovulation is the mechanism, breakthrough bleeding is the side effect. So you should be sure, doctor, one MCQ going to come on the absolute and relative contraindication of OCPs in tomorrow's NEETPG. Drospirenone among the OCPs have a higher risk of thrombosis, including DVT and pulmonary embolism. So when will you start OCP? We start on day 5. So what is combined OCP contain? Mala N and Mala D contain 30 micrograms, otherwise 0.03 milligrams of ethinyl estradiol and 0.15 mg of levonorgestrel plus 7 iron tablets of ferrous fumarate are the part of the Mala N, Mala D. Mala N is supplied by government freely. Mala D is subsidized and priced by social marketing program from Hindustan Latex Family Planning Promotion Trust. Now, अगर miss हो गया तो क्या करना? Miss को बोलना, if a patient misses 1 pill, take 2 pills as soon as possible. If the patient misses 2 pills, use backup method. If you give OCPs, when will the fertility return? The fertility returns within 3 months. You need to be very sure. Saheli, what is this? It is a once-a-week contraceptive, synthetic, non-steroidal. Centachromon or meloxifene is the active ingredient of Saheli. Now, OCPs may high dose, low dose, very low dose. High dose means more than 50 micrograms ethinyl estradiol. Low dose is less than 50 micrograms of ethinyl estradiol. Most commonly used is 35 micrograms. Very low dose is less than 20 microgram. Least possible is 10 microgram. So what is triphasic OCP? It contains ethinyl estradiol plus levonorgestrel, and the dose is increased during the last phase. So it is not a fixed dose. It is safe in diabetics, no longer used for contraception, of course. So day 1 to 6, Ethinyl estradiol 30 micrograms, levonorgestrel 50. Triphasic dose 7 to 11, ethinyl estradiol 40, levonorgestrel 75, 12 to 21, ethinyl estradiol 30 and levonorgestrel 125. And day 22 to 28, you will take dummy tablets. What is Femilon? So these are all such a favorite questions, doctor. Definitely, अभी आप जो पढ़ रहे हैं कल के नीट पीजी में 200 में अगर एटलीस्ट 3 क्वेश्चंस इसमें ये पीडीएफ से नहीं आए तो मेरा नाम मुरली भरद्वाज है. Femilon, it contains 0.02 milligrams of ethinyl estradiol plus 0.15 milligram of disogestrel, which is the 3rd generation progesterone. So, once more I am telling you, doctor, please like this video, share this video to all your friends. And tomorrow, इस वीडियो में जो भी हम डिस्कस कर रहे हैं उसमें से 2-3 प्रश्न नहीं आए तो हम इस मिनिस्ट्री को इस्तीफा देंगे. ठीक है, इतना श्योर शॉट है. प्लीज व्हाट्सएप or call 9000868356 to become part of our WhatsApp study group, and you will get a free PDF of this from the WhatsApp study group, and go to lagnograph.com to download 50 full scale grand tests, all 20 subjects के ऊपर, each subject के ऊपर snapshot reviews which contain 2000 high yield facts and 500 MCQs like mind maps. Okay, so these are going to help a lot. Every year on every Sunday we conduct a full scale grand test and discussion. Every Saturday there is one subject test and discussion. Whether you are preparing for INI-CET, FMG or NEETPG, Dr. Murali Bharadwaj is always there with you. You can form a group of friends, download the PDF from the learnograph.com, share it among yourself, and then prepare for the exam. OCP Femilon. It contains 0.02 milligrams of ethinyl estradiol and 0.15 mg of disogestrel, which is 3rd generation progesterone. Novilon, 0.03 milligrams of ethinyl estradiol plus 0.15 milligram of disogestrel. It has improved safety and tolerance. Today, क्या होता है? Today is polyurethane contraceptive containing 1 gram of nonoxynol 9, which is a spermicidal, and it is effective up to 24 hours. Drospirenone, it is similar to spironolactone. It has a low androgenic progestin. It has no side effect like weight gain, bloating, or hypertension. So what is Yasmin? Yasmin is a newer OCP, ethinyl estradiol plus drospirenone. It lacks androgenic and mineralocorticoid activity, no water retention, no hirsutism. Then long-acting ghistrone, finasteride plus short-acting progesterone is also used as a combination. Now comes mini pill. Mini pill contains only progesterone. Progesterone only pill. What is the most important indication advantage of mini pill? If it is progesterone only pill, it is recommended in breastfeeding women. Mini pill should be avoided in abnormal menstrual cycle, irregular menstrual cycle. So which progesterone does it contain? Micronor means norethindrone 0.35 mg. Overet means norgestrel 75 micrograms. Now what is the main issue with mini pill? Mini pill agar liye to daily without any gap, Lena, otherwise useless. Cerazette is a new progesterone-only pill. It contains progestogen, disogestrel 75 micrograms. Now comes the implants. Very good to see 12 online classmates. हम बहुत खुश हैं doctor. Don't forget to write your comments how much you liked this method of rapid sprinting, right? Very super rapid sprint, picking up a topic which is sure to come in the NEETPG, right? So totally 500 sprints होता है doctor. 500 sprints में मैं जो भी डिस्कस करता हूं उसमें से ही 200 MCQs गर्मा गर्म आपको मिल जाएगा NEETPG में, ठीक है? तो इसलिए don't develop too much expectations about NEETPG. It doesn't matter how many books you read, how much material, how many days you read. Have you read those 500 topics that I am going to release as sprints on YouTube freely? Did you solve the 10,000 PYQs from 2012 to 24? Only that matters. Nothing else will matter, doctor, for the tomorrow's exam. So you need to remember how the OCP, whenever oral contraceptive pill, mini pill you are using. So if it is a mini pill, then it's not a combined pill, only mini pill. It is recommended in the breastfeeding women. It should be avoided in abnormal or irregular menstrual cycles. It should be taken daily without any gap. So what is Cerazette? Cerazette is the new progestogen only pill containing progestogen disogestrel 75 micrograms. Now comes implants. Norplant contains 75 milligrams of levonorgestrel. It is non-biodegradable subdermal implant but useless, obsolete nowadays. Norplant 2, it contains 2 rods effective for 3 years. Uniplant effective for 1 year contains nomigestrel acetate. Implanon, it is a non-biodegradable single rod subdermal implant. It contains 68 milligrams of etanogestrel. It is effective for 3 years and releases 60 micrograms of hormone. Capranon, it is biodegradable implant capsule containing levonorgestrel. Now what is Gossipol? Gossipol is a male pill. If you look at progesterone only pills and IUCDs, there is one common thing for them. Ectopic pregnancies are higher. If you are using IUCD or POP, ultimately you are making the uterus a inhospitable place for the implantation. Obviously, implantation will be preferred other than uterus. Hence, ectopic pregnancies are more common in IUCD and POP users. What is the most common cause of PID in IUCD? Actinomyces israeli. Most common infection leading to early abortions is mycoplasma. OCPs protect against ectopics. So that is the difference. POPs predisposed to ectopic. OCPs protect from ectopic. Postcoital estrogen pill also increases incidence of ectopic. POP also increase ectopic by decreasing the tubal motility. Dipoprogestin, how do you give? Intramuscularly, not subcutaneous, be careful. So dipomedroxyprogesterone acetate, we give 150 mg 1 IM injection every 3 months. Initial injection should be given first 5 days of menstrual cycle, useful in postpartum period. Dipoprogestins, noristerat is a dipoprovera containing progestogen, medroxyprogesterone and is injected into the user every 3 months. So DMPA is especially good for epilepsy patients. Then NEETN, 200 milligram, 1 IM injection every 2 months we give. Now, what is the main side effect of depoprogestins? Irregular bleeding is the most common side effect and weight gain. In depoprogestins, fertility is regained within 5.5 months after starting the depomedroxyprogesterone acetate. So many important points are there, doctor. Totally 190 points are there. You need to revise. Definitely 2 to 3 questions are going to come from this PDF tomorrow exam. Spermicidal agents kill sperms before they enter the cervix by changing the membrane permeability. So what are they? Nonoxynol 9, octoxynol, and menfigol. Now, coming to condoms. What is the main cause of condom failure? Improper use and slippage. Condom slips. Failure rate is 2 to 3 per 100 women years. Femidom is the female condom made from polyurethane. Now, vaginal sponge. Sponge failure rates for women who have never delivered vaginally, nulliparous, is between 9 to 16. But multiparous women have a more patulous cervical os. That's the reason vaginal sponge failure rate is much higher. In vaginal sponge, N9 is released over 24 hours and remains effective 24 hours after the last coitus. Then what are Cialistic vaginal drinks? They contain levonorgestrel, releasing it at 20 milligram daily. Nuva ring, it releases ethinyl estradiol plus etonogestrel at 15 microgram and 120 micrograms. Lea Shield, it is reusable washable barrier made up of silicone, which is placed against the cervix, is what you need to remember. देखो साथियों, one MCQ shoot shot from this PDF. कॉन्ट्रासेप्टिव के ऊपर 2 to 3 क्वेश्चंस अगर नहीं दिए तो प्रधानमंत्री नाराज हो जाएगा. हमारा भारत की आबादी बढ़ रही है. You go to any NEETPG 2023-22 any paper, definitely 3 to 4 questions are asked. Then what are the natural methods? Coitus interruptus, about to ejaculate, and the Army, Navy, Air Force withdraws from the battle. Coitus interruptus. Persona, monitoring the change in hormones controlling natural fertility is persona. Rhythm method is previous menstrual cycles are tracked on a calendar and that will predict the future ovulation date. There are a lot of rhythm method, ovulation calendar, mobile apps, very popular, available on the Google Play Store. So all the fertility awareness methods are based on the knowledge of the fertile period and abstaining sexual intercourse during that fertile period. How do you know fertile period is what? From the shortest cycle, subtract 18 days and longest cycle, subtract 10 days. That will give you the first and last day of the fertile period. So that is called calendar rhythm method. Then what is basal body temperature method? A sustained 0.4 degree Fahrenheit rise in temperature means the lady is ovulating. What is Billing method? Studying the thickness of the cervical mucus. So what is symptothermal method? Mood swings, breast sensitivity, body temperature, change in cervical mucus, all of them if you combine, then you will know whether the woman is in her ovulatory phase. Is called symptothermal method. What is the most effective method to know about the failure rate? Pearl index. Now, what is the lactational amenorrhea method? So, exclusively breastfeeding, no menses since giving birth, less than 6 months postpartum, that is all infertile phase. Suppose if the woman is not actively breastfeeding regularly, then the infertile phase is only for 6 weeks due to lactational amenorrhea. But if she is regularly breastfeeding, then the lactational amenorrhea's infertile period will extend up to 6 months. So morning after pill was a old term. Now coming to emergency contraceptives. Basically, they interfere with the post-ovulatory event, that is fertilization plus implantation. That's the reason they are called interceptives. When we give emergency contraceptive, they are used within 72 hours of unprotected sex. So what is the preparation of choice among the postcoital contraceptives? POP, levonorgestrel 1.5 mg. So you give 0.75 mg levonorgestrel in 2 doses, 12 hours apart within 72 hours after intercourse, or single dose of 1.5 mg. What is UGPA method? UGPA method uses combined oral pill in double dose. It is also effective. And giving estrogen in very high dose also is effective. Danazol can be given in emergency contraception 600 milligrams, but it is associated with androgenic side effects. Nowadays, we are not using. Mifepristone is RU486, and a dose of 10 milligram is effective up to 49 days of last menstrual period. There is a new drug called ulipristol, 30 milligrams, is approved for emergency contraception. Up to how many hours? Almost 5 days. 120 hours it is acceptable. Until when IUD insertion can be done? After intercourse. Aur ek baar, I am telling all the online classmates, every day I will come 1 hour to spend time with you guys to inspire you to prepare. So there are 50 full-scale grant tests already available on the learnograph.com, each containing 30 to 40 image-based questions and around 160 clinical case minute type of MCQs, and every 200 question paper is accompanied by 200 mind maps containing almost 2000 high yield facts for you to do the practice. Additionally, 50 new full-scale grant tests will be started from the next week. For 2025 NEETPG, you can tell your juniors. Every Sunday, we have a full-scale grant test and discussion. And every Saturday, we have a subject test and discussion. Even the subject test is made available as a PDF ebook on the learnograph.com. 3-4 friends together can subscribe to this program so that anyway, the discussion will be free on the YouTube. But you need the notes in hand for you to do the revision. Similarly, there are snapshots, 20 snapshot ebook PDFs made available on the learnograph.com, each containing around 150 to 200 mind maps with 2000 high yield facts and 500 MCQs. That will give you a complete comprehensive revision of the high yield facts. Additionally, 10,000 PYQs are converted into single liners and made available as a PDF called Sprint PDF on the learnograph.com. So be part of the journey. Tell your juniors. Anyway, you are all going to be toppers who are there attending here. But tell a good word to your juniors to attend our interactive, focused revision session. 350 hours में top rank मिल जाना, उससे ज्यादा नहीं पढ़ना. Now, ormeloxifene is centochromone. So until when you can do IUD insertion? 5 days of intercourse. Then mifepristone with misoprostol is effective up to 49 days. Mifepristone with tamoxifen is effective up to 63 days. So what is the approved protocol for the first trimester MTP, doctor? Mifepristone 600 mg day 1, misoprostol 400 micrograms day 3 orally, and clinical examination done on day 15. Day 15 mainly to see that there are no retained products of consumption, POC. POC nahi hai बोल के confirm करना. So OC pills are started on 1st or 5th day of menstrual cycle. What is the most common site for tubal ligation? Isthmus. OCP can lead to cervical cancer, carcinoma breast. If the men and women both are HIV positive, the best advice is to use condoms because a lot of antiretroviral drugs interfere with the effectiveness of oral contraceptive pills. And to use IUCD in HIV, pelvic inflammatory disease is a contraindication. What is the most common symptom of tubal pregnancy? Pain. Most common site of fallopian tube ligation for female sterilization is proximal isthmus. Isthmic anastomosis has best recanalization. So what is the most common tubal ligation method in postpartum period? Postpartum pomeroy or modified pomeroy. So once more, you need to go back and look for what is Uchida method, what is pomeroy method. All those image-based MCQs can come in tomorrow's exam. Good to see Kirti and many more who are all online. Now, if you look at the electrocautery, bipolar cautery is safer than unipolar, but failure rates are least with unipolar cautery. Hulka clip is most readily available reversible method because it causes minimum tissue damage, but also failure rate is very high. In Uchida method, no failures have been reported. That's very wonderful. Uchida. Irving method less than 0.001. Modified pomeroy failure rate 0.2 to 0.3%. Pomeroy method it is 0.6%. Clips have very high failure rate 52.1 per thousand. Bipolar coagulation 54.3 per thousand. So if you look at most effective ligation method, Uchida more than Irving, more than modified pomeroy, more than pomeroy. Least effective ligation for Hulka, clips and bipolar cautery is what you need to remember. Tubal ligation reversal sometimes is needed. If somebody wants to be pregnant after 5 years, 10 years, they want to. Now, what is the success rate of pregnancy return? If it is fallopian ring, it is 50 to 70. Reversal of modified pomeroy is up to 70%. Tubal ligation reversal maximum is with Hulka clips. So, all these image-based questions can come. How Hulka clips looks like, please go through that. And bipolar cautery, how it is done, what is Uchida method, what is pomeroy technique, can I recognize using at the images, please review the Google images, one MCQ going to come tomorrow. You place intratubal devices, you pass transcervically, you will elicit chronic inflammation, and you cause tubal lumen occlusion. So assure, not trisure. Assure is hysteroscopic sterilization, where the coil is introduced into proximal or intramural part of the fallopian tube and lead to fibrosis. It is effective after 3 months. Till 3 months, the couple need to practice alternative method of contraception. So Ovion, Adiona, they're all intratubal devices. So one of the favorite question, what is the contraceptive method of choice? Lactating women mini pill, which is progesterone only pill. Post-coital contraception, it is a POP containing 1.5 mg levonorgestrel. A newly married couple combined oral pill. A villager female IUD. A commercial sex worker barrier method or condom. In HIV positive patient, use condom during intercourse is what you need to remember. Nice to see Mithu Kumar. So contraceptive method of choice for newly married couple of whom female is suffering from rheumatic heart disease. You can't use oral pill like hyperlipidemia, coagulopathy, gallstone, they're all risk factors. Double barrier method is used. If both husband and wife are HIV positive, it is advised for them to use condom. So that completes our journey of 180 points on this very key topic, doctor, which is called contraception. Short, 3 questions are going to come. Once more, please visit learnograph.com. Biochemistry, microbiology, ophthalmology, psychiatry, obstetrics, gynecology, orthopedics, pediatrics. There is a series called Snapshot series. Everything has 200 to 500 mind maps, 2000 to 5000 high yield facts, 500 to 1000 MCQs, and a very comprehensive way to do the revision of the subject within 10 hours. So, doctor, I'm leaving you the www.learnograph.com link below. And these are the phone numbers you can call to be part of our free WhatsApp study group. So good luck. Enjoy the preparation. Be cheerful. Tomorrow we are going to win the election at any cost. Be very sure. I'll once more catch up with you in one more sprint like this in the afternoon. Keep studying. Padhte raho. Last moment mein. Hustle. We need to hustle until exam is over. After that, we will have a champagne party with the tequila shots.